Hi everyone, I'm Jeremy Henderson Tluck-Singh. Thank you for dropping in to learn a little bit about Pride Power Hour, a program to reduce minority stress in the context of substance misuse treatment for the LGBTGEQIAP+ population. Before we dive in, let's just touch base on the drivers that contribute to LGBTGEQIAP+ health disparities. These drivers contribute to the added stress experienced by the LGBTGEQIAP+ community, and these additive stressors is what generally is known to cause minority stress. The concern with minority stress as a driver to health disparities in the context of substance abuse and misuse is that LGBTGEQIAP+ people often use substances as a coping mechanism to reduce minority stress. In fact, various substances are marketed to the LGBTGEQIAP+ population, and they do so by applying cultural elements to the marketing tactics to align their messaging with cultural icons like the use of the pride flag or using rainbow colors. Thus, we know that substance use is reinforced within the LGBTGEQIAP+ culture by these companies, but also bars historically have served as a safe space to meet other members of the LGBTGEQIAP+ culture and community. In a lot of ways, this has simply created a vicious cycle where substances both reduce stress and are reinforced and utilized as a cultural connection point. But we also know that community builds belonging and distress tolerance. And it's important to note that the LGBTGEQIAP+ community across the United States is different, both in rural or urban settings. The community will look and act differently from one to the next. But even within the LGBTGEQIAP+ culture, you will notice significant subcultures and groups and communities form among these groups as well. So we have to understand the culture and community distinctly from each other to thoroughly understand better how to treat this population due to the vast differences in the population. Simply put, we need to consider the whole person when designing LGBTGEQIAP+ treatment programs because of the vast differences among the population. And this is in addition to knowing your patient. So, knowing your patient's social determinants of health, understanding their trauma experiences or experiences geographically, and also understanding where they're at in terms of their life stage and all that comes with development across the lifespan. LGBTGEQIAP+ youth tend to use substances at an earlier age. It might be that this behavior is learned in the home or the community, and more research is clearly required to understand the population's substance use. Further, however, we know that youth tend to use cannabis as a coping mechanism, and they are an elevated risk for alcohol and tobacco use, as well as other illicit or non prescribed drugs, which here we're just calling street drugs. We also know that bisexual youth, particularly those assigned female at birth, are at a greater risk for substance misuse than their lesbian or gay peers. The transgender population is thought to be at a higher risk of substance misuse than their cisgender peers, likely as a result of minority stress. However, several studies report no difference in substance use disorders among this population in comparison with their cisgender peers. Other studies, however, reported that binary transgender people, so transgender males or transgender females, are at a greater risk for tobacco and other substance use, except for alcohol. It's important to note that transgender alcohol and drug use is linked to public violence toward transgender people. So here we're pointing right back to minority stress. More research is required to clear up some of the conflicts in the research and more fully understand this population's substance use and risk. The gay, lesbian, and bisexual population probably has the most research conducted on its use of substances. And as you see here, this population has a greater risk of substance misuse, especially alcohol and cannabis. But what's important to note is beyond that, there are some fundamental differences that are important in the understanding of substances that are being used among this population, and particularly when we look at development of targeted treatment programs. So, for example, here we see that younger lesbians and then older bisexuals demonstrate higher substance use than their heterosexual counterparts. We know that bisexual females report about a 10% increase in cannabis over bisexual males, although both use substances at a greater rate than heterosexuals. Gay men use substances at twice the rate of heterosexuals. And we see here that gay and bisexual males are at greater risk of partner violence, by the way. And that's associated with also with higher levels of drug use. No discussion of the LGBTGEQIAP plus community would be useful without considering race and ethnicity. The intersection of identities among the LGBTGEQIAP plus population is as vast and diverse as the general population itself. So, in understanding how to develop LGBTGEQIAP plus substance use treatment programs, we have to understand race and ethnicity in addition to gender and sexual orientation. A few items of note here. People of color associated minority stress with alcohol use consequences and cannabis use, since they are associating these things with sexual orientation discrimination. Higher rates of meth and cannabis, marijuana are noted among Latino males, and then polysubstance among the Latino population. We see higher rates documented among the Black and African American male population for use of alcohol, meth, and crack cocaine, and then higher rates of alcohol among Black and African American women as well. We see within the Asian and Pacific Islander population, tobacco rates and MDMA rates, so ecstasy, are higher. And finally, we just need to note here that Latina, Black, and African American females demonstrate more significant substance use disparities compared to their male counterparts. Considering the incredible differences that exist among the LGBTGEQIAP plus population, substance use treatment must consider the whole person. So that means that we need to relentlessly focus on removing barriers and demonstrate affirming healthcare and also do so in a way that is culturally competent. Considering all of the factors that I've talked about today, I'd like to introduce you to Pride Power Hour, which is a proposed program designed to reduce minority stress, to treat and prevent substance use disorders, and save lives among the LGBTGEQIAP plus population. This program is available in Nashville, Tennessee, and the surrounding areas. Pride Power Hour is important for a lot of reasons, but primarily to improve health. Minority stress is linked to elevated cortisol, the stress hormone that, when sustained and at elevated amounts, can cause significant harm to one's healthy functioning over the lifespan. Substance misuse is associated with minority stress, whereas tobacco, marijuana, alcohol, and other street drugs are used for stress mediating coping mechanisms. It's important to note that the vicious cycle of substance use to cope with minority stress may in turn increase distress over time as a result of the additional substance use stigma associated with the LGBTGEQIAP plus population. It's also important to note that the habitual nature of human behavior, which may also help to inform the nature of substance use as a coping mechanism, is likely part of the LGBTGEQIAP plus population and experience of substance misuse. Substance misuse in the greater Nashville area is a known concern. While there doesn't appear to be specific publicly available data about the LGBTGEQIAP plus population substance misuse, what we know is that about 3.7% of the population identify as being part of the LGBTGEQIAP plus community. Because the regional data on the size and breakdown of the LGBTGEQIAP plus population is not available, the precise nature of each Pride Power Hour may change to meet the needs of the population. But generally, you can expect a 1-hour session to be delivered on site at treatment facilities and mental health clinics for up to 15 people per session. There's a consistent format that's applied. So we work on convening, we do some pride introductions, we work on a coping skill, some group processing to talk about the use of the coping skill, and then a closing. And each one of these sessions in total costs $300, and that is billed directly to the facility or the clinic. I'm the program manager for Pride Power Hours. I thought it would be important for you to know just a little bit about me. I am a licensed professional counselor and a mental health service provider here in the Nashville area. And I do have cultural competence within the LGBTGEQIAP plus community, both through training and lived experience. You may have additional questions about the program or would like to even sign up and implement Pride Power Hour. So please go ahead and get in touch with us today. You can reach me at www.indigopathcollective.com. And if you'd like a little bit more information about the research and references that went into the development of this prevention proposal, here are references. Thanks again for joining me to learn a little bit more about the Pride Power Hour prevention proposal that we can implement at your treatment facility or mental health clinic. I look forward to hearing from you soon.